not take away control
I'll
locally.
celebrate every
But
Christmas.
a child's quality of education shouldn't
I don't
depend
care.
on the accident of birth.
I don't care.
And that's what happens
importance
too often in our
that
country.
child's education is
The
more
children in
important than my
Philadelphia
stupid
or in
religious
Connecticut or
beliefs,
wherever
whatever
else
they
are
may
going to be
be.
competing with children in Johannesburg,
Religious
and
schools
Sydney, and
have
Moscow,
proven
and
consistently to
Beijing.
perform better
We need to
than the
make the
public
kind of
schools.
investments jointly with our local
We need to have
communities.
less government,
Higher education,
less
community
taxes to
colleges
pay for
need to
public
be more
education.
tuition free. I have an idea on how to do that.
Or at
So we
least
provide that
make teachers
continuum
responsible
from the earliest stages
for
of higher
students that they
education
are failing.
to meet the challenges of the 21st century.
I have to keep you to time, Senator. Thank you. We're going to continue this notion of a lightning round after a quick break. We're going to start our next segment with a question handed to me by a student here at Drexel today. So again, our last break now and a short one. We will continue from Philadelphia right after this.
The Democratic presidential candidates debate was presented by Liberty Mutual. Responsibility, what's your policy? And by Verizon Wireless. At Verizon Wireless, your small business is a big deal to us.
When it's people who do the right thing, they call it being responsible. When it's an insurance company, they call it Liberty Mutual. Responsibility. What's your policy? Liberty Mutual.
Got the estimate?
Just got it.
Spec. Yeah, download it.
Okay, I'm going to try something. I'm going to take Rudy Giuliani's book, Leadership, open up to a random page, probably the middle, and see how it works out. Alright? Page 202. Everyone remember they broke their oath. That night I went on Nightline representing the position of the Reagan administration. Also there was Robert Poley, the PATCO president, who was a nice guy. We debated the merits and demerits of the strike. Of striking against the United States and his demands for across-the-board raises of $10,000 per year, full retirement after 20 years, and 4-day, 32-hour work week. During the debate, Poley suggested several times that Reagan was bluffing, but would never fire the striking controllers, which, by the way, he did. It was a brutally hot night in Washington, and after the debate, Poley and I were leaving the ABC studio across the street from the Mayflower Hotel. We shook hands, and I told him I was sorry his members were out on strike, and that I hoped there was a way to resolve this. Then I said, I hope you take this in the right spirit. This isn't meant to posture or negotiate, but you're wrong. President Reagan isn't bluffing. I asked him to listen for a moment and tell me if this rang true. You've been negotiating for 2 weeks with a group of people representing the president. You're not sure what to do. Some have said to him the very things that you've said, but he can't follow through on this. But go back home tonight and look at a tape of this statement in the Rose Garden and look at his eyes. You'll see that you're wrong and he's going to do what he said. Whatever decision you make, don't make it because you think he's bluffing. I sat in the room with him, I watched him decide, and looked in his eyes. This is a very convinced man, and you're making a miscalculation. If you think public pressure or union pressure will get him to change his mind. I looked into his eyes. This is a very convinced man, and you're making a miscalculation if you think public pressure or union pressure will get him to change his mind. Without putting it quite this way, Poley replied in effect, you don't know what you're talking about, kid. There were people in the cabinet arguing against President Reagan's deadline. They said that he couldn't carry it through, and when he backed down, it would be worse for having bluffed. They were basically advising him to warn the unions, threaten them, but then not to take a firm stand that he couldn't take back. The president made it plain that if he didn't draw the line this time, he'd have little credibility next time. What happened if the FBI decided to go on strike, or the Navy? It was a matter of principle. If you work for the people of the United States, you waive the right to strike. Well, that's from a random page.
We are back at Drexel University in Philadelphia, something we'd like to institute as the lightning round. We put a clock and a noise, perhaps not loud or severe enough on the screen as we tried this out. In the previous segment, we're going to try to get tougher and heavier concerning our enforcement. I promised to begin with a question handed me by a Drexel student today. It dovetails, and Senator Dodd, we'll start with you, it dovetails with what physicians have asked me to ask in this room to this group here tonight. With so many young people choosing not to go into medicine, so many veteran physicians choosing to get out or losing heart because their ability to earn an income is going down. How do you expect this nation to continue to attract quality people to medicine?
That's how they expect to do it.
Well, a couple of things very quickly.
They don't care about the
30
number of
seconds
doctors.
here,
The
but
doctors
first,
need to make
obviously
a living.
providing some
They need to
benefits to
consider
people who
the
choose to
factor
go into
that the
that
fact that they're there
educational
is to make money,
profession,
because money
so
is
we can
greed,
attract
greed is
them to
evil.
work in areas that they're needed. And that
They should
certainly
only
needs
be
to
there
done.
to help you.
I believe there's an
Hell, they
answer to the
shouldn't make any
medical
money at all.
malpractice issue, not the ones the
It's not money
Republicans have
that
been
drives it.
proposing, but that's one of the issues
It's
that
not money
people are
that drives
concerned
it.
about.
Better
And as part of a
doctors,
larger
better
healthcare
service.
plan, ought to be a
Compete
part
with
of
other
that. We
doctors, which
consider
they won't have to.
universality and
There's a
other elements
socialized
here
system. They don't have
to
to
make
compete.
sure that this profession becomes one where the cost of insurance, the cost of other items here are not going to be so
How are you going
excessive
to lower
that you'd be
insurance by
discouraged from
raising
going that
everyone's
direction.
taxes
Senator,
to
thank
pay for
you. Senator
use
Biden.
socialized
You got to help
medicine?
them pay off their education. They start off in the hole. They graduate and they do gigantic
government should
bills,
pay for their education, more
$40,000 a
taxes.
year.
Beautiful.
They graduate hundreds of thousands of dollars in debt. You got to give them ability to write that off if they engage in public
That's right,
service,
because they're
proven
doctors.
areas where they need
Screw the
doctors.
colleges.
Number one. Now, number two, you gotta
Making
get the
money
insurance
is
coming
not
out
in
looking over
any-
their shoulders and everything. They know
It's not in your
the decisions to
lexicon.
make.
The
They
thing
know
that
what
drives
they
the
should do,
economy.
and they should be rewarded for their
Supply and
decisions.
demand,
The lights
money, the
on,
free
and I
market.
want you
None of
to
this
stay
enters.
inside my time.
Oh, the
Very
problem with
good. It's a
doctors.
new tough guy policy.
Free degrees.
Senator, thank you.
Give money for
Senator
college.
Edwards.
Because they need it. They should have
What we
it.
need is a universal health care
So then
system that gets
the
doctors out of the business.
standards of the
and deal with
colleges go
insurance
down
companies
because
on a
everybody
daily
gets in,
basis to
because
protect
everybody
them from that.
has
But
money,
I want to talk about
everybody can
another
get
piece
in.
of this, which is we have a
Doesn't matter.
nursing crisis in America,
Right.
a serious nursing crisis. So
I'm
what
saying
we
that
need to
people
do is
without money
expand
are
our nursing
stupid.
schools, give scholarships to young people who are willing, when they go to nursing school,
The
to
reason
commit
why
to come
college
out and go
costs
to the
money.
places that are underserved.
Things
We need
cost
to
money.
get
It
rid of
costs money
things
to
like
teach.
mandatory overtime. We need to have safer staff-to-patient ratios so that we can deal with this crisis for the men and women who actually provide a huge amount of the health care in this country.
Senator, thank you. Senator Clinton.
Well, again, I agree with everything that has been
So you have
said.
the
And
government
my
pay for them,
proposal
because they're gonna have
for the
socialized
American
medicine.
Health Choices Plan,
That's great.
we basically give the insurance companies an
They'll get a
ultimatum.
flat rate of how much they pay. Doesn't
have
matter how
to
many
get
patients
into the
they have,
business
doesn't
of
matter how well
actually
they're doing.
providing insurance
Government will give them
instead
a
of
flat
trying to
rate of money,
avoid
which you
covering
think is
people.
okay.
They cannot deny people
Just like
coverage.
Obama said,
They
50,000.
cannot
Everybody above
exist
50,000.
at a pre-existing
He's
condition
sort
which
of a
is not
number out of
covered.
his- out of his
That is
soul,
one of the biggest
50,000.
problems that doctors
It's
face.
a number
They
that he
face this
decided is
constant
okay.
barrage
We need to
of
live.
harassment and bureaucratization from the private insurance world. We also need to
Bureaucratization?
clean up Medicare and Medicaid.
We
They're
can
not as
socialize healthcare.
friendly as they need to be either.
Senator, thank you. Senator Obama.
We need to deal with
How
the
would you
insurance
raise taxes,
companies.
Senator Obama?
On Medicare and Medicaid, the reimbursement system is not working the way it should. And by the way,
Capitalist system is not working the way it
instituting a
should.
universal healthcare system
market
that
not working the way
emphasizes
it should.
prevention will free up dollars that potentially then can go to reimbursing
Socialized
doctors a little
medicine
bit more.
will
But we've got to deal with the
destroy
cost
this country.
of medical education. We have to deal with college costs generally, and that's why
We'll
I
have
put
a
forth
sick and
proposals to
dying
get banks
nation.
and middlemen out of the process and expand national service to encourage young people to go into these helping professions where we need
has
a
never
lot
worked.
more work.
Senator, thank you. Congressman.
I'm the co-author of the bill H.R. 676 that establishes Medicare for all. As long as you have the private insurance companies involved in providing health services, people aren't going to get care. Doctors know that the insurance companies want to substitute their judgment for their practice.
So I need to
Everyone
keep the
knows that
government
the
coming and
insurance
pay for
companies
that by
make
raising
money
taxes
not
for
providing
everyone
health
else.
care. I'm standing for Medicare for all. There is no one
We
else on
decide
the
that you
stage
need the internet
who is
to
ready to
survive
take
in
on
this world.
the insurance
The government
companies
pay for that.
directly by saying
When does working for your own
every other
money and paying your own
industrialized
way
nation in
come
the
in
world
as a
by
factor?
caring for our
Workers
people
need
by
above
having a
all else.
not-for-profit healthcare system. Just because you say it's universal doesn't mean it's not for profit. Even the insurance companies want a universal
He's
healthcare
insane,
system.
Congressman. Thank you, Congressman. Governor Richardson.
Well, I have a specific proposal. Here it is. In exchange for 2 years of
We're
tuition
gonna
paid
give you
by the
money.
government
We're
or
gonna give you
loans,
paid by the government.
you
Yep.
give 1 year of national service to the country. This
National
will
service,
attract
do you
more
listen to
doctors
this?
and will enable
It's the
students
return of the draft.
to afford
One of the things
college
we learned from
education.
Vietnam,
It's taken them 7
draft
years
does
to
not
pay for
work.
this. Get rid of
Public
the student
service.
loan and bank agencies
right.
that are ripping off
Public
the system.
service by force.
Reestablish on a general basis the
Public
doctor-patient
service.
relationship.
Which basically means working
Deal
for
with
less money.
Medicare reimbursement.
Things that you're
Deal
not
with
interested
ways that we also
the return
not
of the
forget
draft.
health professionals, and that's
Public
nurses,
service.
that's others that in
Because the
our
government will be
healthcare
so
system
huge, they will need
are
somebody
not
to
given the
staff
same
this
opportunity.
humongous
Governor,
healthcare
thank
industry.
you. Senator
We'll
Obama,
force
a
doctors
question
into
to
public
you.
service.
More. Yeah, sorry, the rules are in
But
effect.
generally speaking, this president has failed on this issue. We've got to keep on. We have to make a much bigger progress than we've done.
We should probably repeat. The lightning round continues with my colleague Tim Russert.
Thank you, Brian.
Senator Clinton, Governor of New York, Eliot Spitzer, has proposed giving driver's licenses to illegal immigrants.
How do you give
He told the
licenses to
National
somebody
New
who's not
Hampshire
here?
editorial
I
board
understand. How do you
it
have a
makes a
license?
lot
How
of
do you not
sense.
immediately
Why
arrest
does it
them
make
once
a
you
lot
walk
of
through the door?
sense to